Make America Healthy Again, the following is some, just some, of what we must do. Medicare for all. Healthcare is a human right. End of discussion.
Bernie Sanders pushing Medicare for all so that everybody has access to health care. Also, we're seeing Representative Ro Khanna saying the U.S. should be moving toward Medicare for all to cure inequities. Speaking of Medicare, Medicare bills are increasing. I'm going to let you know who's impacted. I'm also going to play you that full video clip of what Bernie Sanders has to say about Medicare for all. Speaking of Medicare, I want to get your opinion on this. So the weight loss drug Ozempic may be up for Medicare price negotiations. Will Trump support it? I'm really curious. Should Ozempic be part of Medicare? Should taxpayers pay for Ozempic? If you're not sure what Ozempic is, it helps people lose weight. It's kind of a trend right now. What are your thoughts on that? I'm going to give you some other important updates as well. Before I dive into the main content, if you appreciate the Social Security updates, hit the like button and subscribe to the channel for more Social Security updates. So the weight loss drugs like Ozempic may be up for Medicare price negotiations. Will Trump support it? So the 15 more priciest medications selected for negotiation program is supposed to be released by February 1st. So really curious. I want to get your opinion on this first before moving forward. Should Ozempic be supported by taxpayers? Should it be given to people? This is something that Biden has supported, I think about a month ago, to have the government support Ozempic, which is a weight loss drug, going out to people under Medicare. Is this a good idea, bad idea? Let me know your thoughts on that. So we're going to get into Leave No One Behind, America Needs Medicare, as well as Medicare bills are increasing. I'm going to let you know who is impacted by this and by how much. But first, let's take a listen to Bernie Sanders.
Hello, everybody, and let me take this opportunity to wish everybody a very happy new year. Over the past year, I've had the privilege of serving as chair of the U.S. Senate Committee on Health, Education, Labor, and Pensions, the HELP Committee. And as I leave that position, let me reflect a little bit upon where I think our country should be going in healthcare and the obstacles that we face. Most importantly, and this is the main point that I want to make over and over again, we are the wealthiest nation on earth. There is no rational reason as the wealthiest nation on earth as to why we should not be the healthiest nation on earth. We should be leading the world in terms of life expectancy, disease prevention, low infant and maternal mortality, quality of life, and in fact, human happiness. That's what happens when you're the wealthiest country on earth. You could do those things. Sadly, however, study after study shows us that despite spending almost twice as much per capita on healthcare, we trail most other wealthy nations in all of those areas. If we're going to reform our broken and dysfunctional healthcare system, and if we're going to, quote unquote, make America healthy again, the following is some, just some, of what we must do. Medicare for all. Healthcare is a human right. End of discussion. The function of a rational healthcare system is to guarantee quality healthcare to all, not huge profits for the insurance company. The United States cannot continue to be the only wealthy nation that does not provide universal health care. It is not acceptable that while spending almost 18% of our GDP on health care, millions of Americans delay going to the doctor, and 60,000 Americans die each year because they can't afford the care they need. Think about that. 60,000 of our fellow Americans die every year because they can't afford the medical care they need. It is also not acceptable that hundreds of thousands of Americans go bankrupt because of medically related causes. You should not have to lose your home and go into financial distress because you have cancer. Further, we must lower the cost of prescription drugs. As Americans, we should not be paying, by far, the highest prices in the world for life-saving medications. It is absurd that while the pharmaceutical industry enjoys huge profits and benefits from U.S. taxpayer research, 1 out of 4 Americans cannot afford to purchase the prescription drugs their doctors prescribe, and we sometimes pay as much as 10 times more for the same exact drug that is sold to people in other countries. We must cut, and we can cut, prescription drug prices in half by making sure that we pay no more for medicine than the Europeans or Canadians pay. Paid family and medical leave. Workers should not have to go to work when they are sick. Doesn't seem like a terribly radical idea to me. Mothers and fathers should have ample time to stay home with their newborn babies. Do you know, in some countries, in Europe, when you have a baby, mom and dad get 6 months time off to bond with that baby. A parent should not get fired when they stay home with a sick child. We must guarantee at least 12 weeks of paid family and medical leave to every worker in America. Not a radical idea. That exists all over the world. We must reform the food industry. Large food corporations should not make record-breaking profits by making our children addicted to processed foods, which then make them overweight and prone to diabetes and other diseases. As a start, we must ban junk food ads targeted to kids and put strong warning labels on products high in sugar, salt, and saturated fat. Longer term, we can rebuild rural America with family farms that are producing healthy, nutritious food. We must raise the minimum wage to a living wage. Yeah, that's a healthcare issue. Millions of workers should not have to worry about how they'll pay the rent or buy food for their kids. Working class Americans live far shorter lives than the rich because of the stress of trying to survive on a paycheck-to-paycheck existence. Stress kills. Stress makes us sick. We must raise the minimum wage to at least $17 an hour and allow the American people the opportunity to relax just a little bit and some of that incredible economic pressure that millions are facing. We must lower the work week to 32 hours with no loss of pay. People will live longer and healthier lives if they can spend more time with family and friends and have the opportunity to enjoy their leisure time. Advancements in technology, automation, and artificial intelligence must benefit workers, not just billionaires on Wall Street or in Silicon Valley. We must combat the epidemic of loneliness, isolation, and mental illness. Too many Americans are struggling with intense anxiety and what the doctors call diseases of despair, and that is alcoholism, drug addiction, and even suicide. Not only do we need to greatly increase access to mental health care, we must rebuild our sense of community and create a culture into which we better enjoy and appreciate each other as human beings. We must also take a very hard look at the impacts smartphones and social media are having on our mental and physical health. We must address the climate and environmental crises that we face. Every American is affected when the Earth's temperature rises and the air we breathe is polluted. Climate crisis and extreme weather disturbances will cause more widespread suffering and disease, economic disruptions, and population dislocation. Air pollution is a major risk factor for respiratory and heart disease, cancer, and other health problems. The fossil fuel industry cannot be allowed to continue making us sick shortening our lives and destroying the planet. We must create a high-quality public educational system. Lifelong education is a human right and should be obtainable for all in a wealthy nation like ours. Health, life expectancy, and economic well-being are often tied to educational attainment. Instead of spending $1 trillion a year on the military, we should make certain that all Americans, from childcare to graduate school, are able to enjoy free, high-quality education and job training. Let's be clear. The way forward to creating a healthy society is not radical, nor is it complicated. Many of the components that I've outlined right now, they already exist in one form or another in numerous countries throughout the world. These are not radical ideas. Our real problem is not so much a healthcare crisis as it is a political and economic crisis. We need to end the unprecedented level of corporate greed that we are experiencing. We need to create a government and an economy that works for all of us and not just the wealthy and the powerful few. Thank you all very much.
What are your thoughts on what Bernie Sanders had to say? Do you agree, disagree? Is Medicare for all a good idea? Should everyone be under Medicare? Is Medicare a human right, or access to healthcare a human right? Let me know your thoughts on that. So this is pretty popular, mostly among the Democrats, especially Representative Ro Khanna saying U.S. should be moving toward Medicare for all to cure inequities. This is Ro Khanna right here, representative of Congress in California, basically saying this, that Khanna has said he supports Trump's efforts to create a Department of Government Efficiency to cut wasteful federal spending. And he's saying that they should look at the extraordinary waste, especially in Medicare and the private health costs, saying, I think when it comes to defense, getting better defense for value and cutting cost, there can be huge bipartisan cooperation. Also saying that cuts to Social Security and Medicare should not be on the table. I think everyone would agree with that. Basically saying that there should be Medicare for all. When it comes to this, this has been a concept, especially by Bernie Sanders, being pushed for many years, actually, saying leave no one behind. America needs Medicare for all. Basically saying this, that, 8% of Americans, which is 27 million people, don't have access to medical care. Basically saying that it's actually costing the government more, or the country more money, by having less people able to work and contribute to the economy. If all these people had access to medical care, they would live longer, healthier, and have a better economy. That's kind of the concept here. When it comes to Medicare bills are increasing, who's impacted? Let me get into that. Unfortunately, this is what happens with Social Security. As your Social Security goes up from the COLA, the pathetic 2.5%, Medicare Part B, which covers doctor and outpatient hospital visits as well as select home health services and medical equipment, goes up as well. So the premiums went up $10.30 from 2024 to $185 per month, which basically eats away at that 2.5% COLA. Part B deductibles will also see an uptick to $257 this year. That's a $17 rise from the $240 annual deductible in 2024. There is some good news for beneficiaries, though. After the Inflation Reduction Act changes, annual out-of-pocket Medicare Part D costs, drug costs, are capped at $2,000. So this out-of-pocket cap matters once Medicare recipients meet their deductible, and then they pay 25% of the co-insurance until their spending on drugs reaches $2,000. Insulin costs have also been capped at $35 per month, potentially saving seniors with diabetes thousands of dollars per year. So yeah, it looks like Medicare still going up. There is a cap, but what are your thoughts? Should this all be covered? Under Medicare for All, should you not have to pay anything? Should Medicare Part B be capped as well? Maybe not go up at all this way. That always stays this way. Once you get an increase in COLA, at least you don't have an increase in Medicare Part B as well, right? It makes no sense to have an increase in COLA and then it gets eaten away by your Medicare Part B, or even inflation and everything expensive around you. So it definitely needs to be big changes. I'm going to keep you updated on what happens with this, and that is all the news that I have for you today to hopefully brighten your day a bit. Here's my daughter Bella's tip of the day.
Hi guys, this is a tip of the day. I want to tell you the one thing when you feel sad, you have to do something that you really want to make you feel better or make you feel true. Or you can also, if you help somebody, then you'll feel even better or something. Or if something's really into you and you're really feeling good, you should do that as well. Bye, this is Bella. This was the tip of the day.
If you haven't caught what has been said about Social Security in the new Congress of 2025, as both Democrats and Republicans are talking about it, click this video over here. I'll let you know how the Democrats and the Republicans are distracting you from the real issue of Social Security that almost nobody's talking about. You're going to want to see that, so click that video now, and I'll see you in that video. Take care, be safe. Thank you for watching.